reported nearly 20,000 new COVID-19 cases in the last reporting cycle. That's the highest figure since the announcement of this Omicron variant, which was detected by local scientists 2 weeks ago. Let's talk about these concerning figures. We're joined tonight by Progressive Health Forum convener, Dr. Aslam Dasoo, and Ministerial Advisory Committee on COVID-19 member, Professor Ian Sanne. Prof, and you, Doctor, a very good evening to you both. Welcome to the program. If I can ask you first, Dr. Aslam Dasoo, can we ride this wave without a stricter lockdown?
Good evening. Yes, I certainly believe so, and so do a growing body of scientific opinion. Does a growing body of scientific opinion that we actually can, given our experience over the last 2 years, where we have learned exactly what works, what doesn't. We know where the biggest impacts are, and we know what is, just turning into hygiene theater. So what we do know, of course, is that vaccination is the central pillar of any response. And we are still at desperately low levels, even though the numbers are now ticking up and there appears to be a more concerted effort to get people vaccinated. But there's very little else. Locking down the country, creating restrictions on business, etc., is not going to really stop the spread of the virus. And we also know that if you're vaccinated, the chances of you getting severely ill are very low. So I think a combination of this vaccine drive, maintaining masking, which we know works, and certainly prohibiting large non-essential indoor gatherings may have some effect. But beyond that, there's very little else that will mitigate the spread of this virus.
Professor Ian Sanne, let me come to you, and I hope I'm doing your surname justice. So in the latest report, we got 19,000 plus positive cases, 34 deaths. One death is a death too many. But when you look at that ratio, it is still relatively low. Can it be maintained in the long term without vaccination?
Yes, thank you very much for the continued important interest of every of your viewers. The data I'm seeing is a little higher than what you're quoting. The 8th of December data released by the NHLS is, in fact, 23,246 new infections. The admission rates are increasing. They are predominated in Gauteng, both public and private. My sense is that we need to do what we can to reduce the incidence of COVID, and I think Dr. Dasoo has, in fact, very eloquently spoken to those. We do need to get into a sense of, do what is essential and don't do what is non-essential. So certainly work is essential. I think the health sector is gearing up for the surge of more patients coming to hospital. We are seeing a trend towards less severe disease. 75 to 80% of people admitted to hospital are unvaccinated. So indeed, we have to actually ramp up vaccination, persuade everybody who's been sitting on the fence to go ahead and do that vaccine. We are seeing a trend towards younger people becoming infected, and I think that's a reflection of multiple rounds of lockdown and school closures during the various waves, plus the access to vaccine coming for children, adolescents between the ages of 12 and 17 coming late. I appreciate government has now made the decision to go ahead and give the second vaccine. I would really also hope to see the decision very soon to give everyone a second dose of J&J vaccine, and to in fact boost our older population.
And the numbers I was quoting, Prof, were from an NICD report out yesterday, and perhaps maybe we'll get a reflection on the data that you were referring to later today. As a member then of the Ministerial Advisory Committee dealing with the COVID-19 pandemic, the outbreak in the country, what do you think should be top of mind for government in response to all the challenges which you've just laid out?
I think a clear understanding and a clear communication to the population that we are in the fourth wave, that indeed social distancing, masking is the primary driver of reduce transmission. The second is that we need to really avoid gatherings, and then the development and surge capacity development of our hospitals to make sure that one of the facets is this incredible rapid rise in cases may in fact lead to an incredible rapid rise in hospitalization. Anything that changes fast is not good for our health sector, because indeed it does displace other health treatments that are ongoing. And in fact, also some of the experience that we're having at the moment is that our healthcare workers themselves are becoming infected with the Omicron virus in general mildly because they are well vaccinated, but indeed it does put them off work. So we've got real problems with the staffing of our healthcare facilities, and people can in fact help us out by in fact avoiding gatherings both indoor and then the large and outdoor gatherings.
So, Dr. Dasoo, let me come to you then. So far, early indications, and early, I stress that, are that the Omicron variant appears to be, at least on initial data, more transmissible, but perhaps causing less severe illness. Do you think that could work against the vaccination message with government saying it's urgent to be vaccinated, but if people think, well, you don't get seriously ill, some may say, what's the point?
I think you put your finger on a real danger. You know, our messaging around the pandemic has been suboptimal to begin with. And I think there is a great deal of exhaustion now in the general population, in dealing with this pandemic. So to put out, messaging that says, look, man, this is going to be a mild infection, don't really have to worry, may in fact cause people to lower their guard. And in fact, it would be wrong to actually send out a message that because we are seeing initially mild infections, and Prof. Sanne has outlined what's coming through in our health facilities, it's still early days. We need to understand really what the full impact is going to be on our health system of those getting infected over the last week, because, they take a week to 10 days, up to 2 weeks to present to hospitals. So until we are at that point and can make a clear assessment of the condition that people are in at that time, we can't really say that this is going to be a variant that only gives us mild illness. So I think we need to take the posture that we have held in the past, that we are still in the grip of the pandemic, in the emergency phase of the pandemic, and take all the necessary measures to mitigate those. Of course, with the experience we've got, we can now target those mitigation measures. We understand that we can actually predict cluster outbreaks in certain districts. We have the modeling and the data to do that 2 weeks hence, and can take measures in those areas to perhaps some restrictive measures to avoid those health services in those districts being overwhelmed. So it's still all hands on deck. The surveillance is as intense as ever, and as it should be. And we are not in any position to make a definitive statement that this is going to be a mild illness brought on by the Omicron variant. In fact, the large numbers that we are seeing that are being infected, that portends that, especially in a low vaccinated population, that the fallout into severe illness and hospitalization and even deaths may well rise in the next coming weeks.
Dr. Aslam Dasoo, Progressive Health Forum convener, as well as the CEO of Right to Care, member of the Ministerial Advisory Committee on Covid-19, Professor Ian Sanne. My thanks to you both, gentlemen. Thank you so much for being on News at Prime tonight.